Our project targeted young African American men living at San Quentin but returning to Alameda County within 3 to 4 months. We were looking for men who were experiencing either depression, anxiety, or some kind of mental health symptoms. So we used a couple of strategies to identify what would work best with this population. We identified a group of peers who were African American men who lived in the facility for many, many years and asked them a series of questions about outreach. One of the things they suggested is to not use the word mental health. Secondly, they suggested that we talk to men about post-release concerns. What were their fears? What were challenges? What things did they need to be successful once they returned? And the third thing they suggested is that we gather them in a group that was non-threatening. Those strategies proved to be effective inside the prison. Once people returned home, engaging them into mental health services and also into a medical home proved to be a little more challenging. So we conducted another focus group with men who were recently released and asked, what would it take to get you to follow through on your first medical appointment, to go to a doctor, and maybe even to see a mental health professional. They gave several suggestions. One would be a warm handoff, that we just didn't give them a 1-800 number, that we actually gave them a live person and a name. And what they called it was the hookup. Secondly, they suggested we don't want to go to a mental health office or a sterile place. We'd like to go to some place in the community. We'd like to meet at McDonald's or our neighborhood community center. And then thirdly, they suggested, and until we can get it and understand that our physical and mental well-being is important to our livelihood, offer some incentives like bus passes. And we did things like that. We even offered bikes for people who made 6 sessions. So those things proved to be particularly effective with the African American young population that we were serving.